Hello everyone, the disease I would like to discuss with you today is headache. Headache is a common disease with self-conscious symptom located at the upper part of the head. It can occur alone or be seen with many acute or chronic diseases. Let's review the historical records of headache. The name of headache is first seen in the inner canon of the Yellow Emperor, referring as wind of the head, 手风, and wind of the brain, 脑风. Related records may also be found in the discussion of Taiyang disease, Yangming disease, Shaoyang disease, and Jueying disease in the treatise on febrile diseases. After that, headache was divided into two types of exogenous and endogenous ones, and was supplemented in Taiying syndrome and Shaoying syndrome, according to the Dongyuan Shishu. Then, phlegm syncope syndrome, qi stagnation syndrome, and the use of meridians and herbs were supplemented in the Danshi Xingfa. The acupuncture treatment for headache embodies the characteristics of syndrome differentiation of meridians and collaterals. As we all know, meridian differentiation by distinguishing body parts is a very important method of differentiation of meridians and collaterals to determine the pathogenical changes of its belonging meridians and collaterals in the light of disease location. In treating headache, this feature is particularly typical. For example, Yangming meridian passes through the forehead. So, if the pain is located at forehead, it will be attributed to Yangming syndrome. Shaoyang meridian passes through the lateral side of the head. So, if the pain is located at the lateral side of the head, also called migraine, it will be attributed to Shaoyang syndrome. It is well known that gallbladder meridian passes the backside of our body, such as occipital part. So, if the pain is located at the occipital part of the head, it will be attributed to Taiyang syndrome. Jueying meridian goes up to the top of the head, so if the pain is from there, it will be attributed to Jueying syndrome. This classification of four syndromes of meridians and collaterals are particularly common in clinic, especially in the treatment for the exogenous headache. So let's take exogenous headache as an example and introduce the meridians, differentiation, and treatment. Firstly, invasion of pathogenic wind is obviously an important cause, since exogenous headache is an externally affected illness. The therapeutic method is not only to unblock collaterals to relieve pain, but also to dispel wind to clear orifices. Which main acupoints can we select clinically? 列缺, 百会, Taiyang, 风池 are preferred ones. What do we select these acupoints? As we all know, 列缺 on the long meridian is a luo connecting point. This acupoint has a very good function of dispelling wind. It is especially indicated for the headache due to wind cold. And there's also records about 列缺 in the Song of the Four Command Points, which states, select 列缺 when the disease is located at head and neck. So selecting 列缺 to relieve the pain located on the head and the neck is a classical method of acupoint selection in acupuncture practice. That is the reason why we choose 列缺 firstly for exogenous headache. Secondly, we can select 百会. Where is 百会 located? Yes, it is on the midpoint of the line connecting the two ears. This acupoint belongs to the dual meridian, which is also called 3 yang and 5 intersection, 三阳五会, or the palace of multiple, 离丸宫. This acupoint has a favorable effect of awakening the mind and restoring consciousness. It is also commonly used to treat exogenous headache. Thirdly, Taiyang is the third acupoint selected, which is very popular in public. Taiyang is an actual acupoint. Where is Taiyang located? Can any student point it out? Yes, it is here. Even the ordinary people could find it by themselves. Taiyang is also a very commonly selected acupoint to cure exogenous headache. Firstly, we can select Fengchi. Fengchi belongs to the gallbladder meridian. It locates at the posterior side of the neck, and it also has a good function of dispelling wind. In general, the combined application of Lieque, Baihui, Taiyang, and Fengchi has a strong effect on blocking collaterals to relieve pain and dispelling wind to clear orifices. Besides these main acupoints, we will select the combined points according to different locations of the disease. As I have mentioned, pain on the forehead is attributed to the disease of Yangming meridian. Therefore, acupoints from Yangming meridian is primarily selected, such as Hegu and Leiting. And we can also select Yintang and Cuanzhu on the forehead. And let's review the locations of these acupoints. Yintang belongs to Du meridian according to the National Standard of Acupoints, 2006. It locates on the midline of the head between the two eyebrows. When doing acupuncture on Yintang, we should pay attention to the technique of lifting and pinching. Pinch the skin on both sides near the two eyebrows with your fingers and then insert the needle. This is a point that we emphasize much when introducing the techniques of acupuncture and maxibustion. The second acupoint is Cuanzhu. Where is it? Yes, it locates at the hollow part of our eyebrows. It belongs to the bladder meridian. Since Cuanzhu locates at forehead, we usually select it to cure Yangming headache. Since the acupoint locates at the local region, it can be applied for treating local problems. Additionally, we can select Hegu and Leiting. I think everyone is very familiar with Hegu. It belongs to the large intestine meridian of Hand Yangming. Where is it? It is between the first and second metacarpals, near the midpoint of the second metacarpal. This acupoint has the effect of curing Yangming headache. Because the meridian it belongs to passes through the forehead. Our last acupoint I'd like to address is Leiting. It belongs to the stomach meridian of foot Yangming. What we always remember is its role in treating gastroparetic toothache. But in fact, it also has a good effect on headache. Leiting is the yin point of the stomach meridian of foot Yangming. Yin point is good at clearing stomach heat, so it is also suitable on clearing wind heat. The above information is all about Yangming headache. The next type of headache is Taiyang headache, which locates at the back of our head. Which acupoints do we usually select? A local acupoint is our first choice. Which acupoint is the most suitable one? Yes, it is Tianzhu. Its location is just around the back of the neck and the head, so it has a good effect on curing posterior headache. We can also select Hoshi from the small intestine meridian of Hand Taiyang and Shenmai from the bladder meridian in the light of their meridians pathways. Where is Hoshi? Can anybody show it to me? Yes, it is in the hollow at the back of the fifth metacarpal phalangeal joint. Hoshi is one of the 8 confluent acupoints connecting the 8 extra meridians that we often say. It connects to the Du meridian. The Du meridian passes in the middle of our back and also our posterior head. Therefore, the theoretical basis is not only because it belongs to the bladder meridian, but also because of its connection to the Du meridian. Moreover, we can select Shenmai. Shenmai belongs to the bladder meridian and belongs to one of the 8 confluent acupoints connecting the 8 extra meridians. Which vessel does it connect with? Yang heel vessel or yin heel vessel? Yes, it connects to Yang heel vessel. Zhao Hai is the one connecting with Yin heel vessel. Both Hoshi and Shenmai belong to Taiyang meridians. The former belongs to the small intestine meridian, and the latter belongs to the bladder meridian. These two acupoints are selected in terms of the selection according to meridians. When treating Taiyang headache, we should certainly take acupoints from Taiyang meridian. For example, we can take 外关. Where is 外关? Yes, it is 2 inches on the back of the hand, between the radius and ulna. 外关 is not only the lower connecting point of the Sanjiao meridian, but also one of the 8 confluent acupoints connecting the 8 extra meridians. Which vessel does it connect with? Yes, it connects with the Yang linking vessel. So 外关 is used for Taiyang headache in terms of the selection according to the meridians. In addition, we can select 帅骨. It locates at the lateral side of our head, so it is considered as the local acupoint selection. Meanwhile, it belongs to Taiyang meridian. Another choice is 足灵气 on our feet. 足灵气 belongs to the gallbladder meridian of foot Taiyang. Taking 足灵气 on Taiyang headache embodies the principle of treating food for headache according to distal acupoint selection. Lastly, pain locates at the top of the head is attributed to 厥阴 headache. At this time, we take the acupoints on the top of the head. We can also take acupoints on 厥阴 meridian since they belong to it. Which acupoints? For example, 四神冲. We have mentioned 百会 as a main acupoint. 四神冲 belongs to the extra acupoint. 四神冲 is actually a combination of 4 points, then locate about an inch on all sides of 百会 point. Where are they located exactly? Let's find out 百会 first, and then look for about an inch on each side of it. These are the acupoints at the top of the head. We can select 太冲 of the liver meridian and 肋关 of the pericardial meridian of hand 厥阴 as distal acupoints. You might be quite familiar with these 2 acupoints. 太冲 is the 圆 point and is also the through point of the liver meridian. It locates between the first and second toes. 肋关 is the lower connecting point of the pericardial meridian and is also one of the 8 confluent acupoints connecting the 8 extra meridians, connecting with Yin linking vessel. Its position should be memorized in your mind. Where is 肋关? It is 2 inches up to the horizontal line of the wrist and palm, between the 2 tendons. This is also a very common choice for treating 厥阴 headache. Therefore, taking the external headache as an example, we can see the method of treatment on the basis of meridian differentiation. Acupoint selection involves more than the concept of local acupoint selection, and also the concept of distal acupoint selection according to meridians. So, it's crucial for us to employ these acupoints in the clinical practice in future.